Hey everyone, in today's presentation, we will be discussing about the chronic disease ALS, known as amyotrophic lateral sclerosis. It is a motor neuron disease that gradually paralyzes individuals as the brain is no longer able to communicate with the rest of the muscles of the body. So let's begin our presentation.
ALS as a progressive chronic disease. ALS is a progressive disease that develops slowly over time. Symptoms progress as they begin in the hands, feet, or limbs and eventually spread to other parts of the body. ALS traditionally begin on one side of the body with painless muscle weakness and wasting and can cause loss of hand dexterity, shoulder function, foot dropping, or walking difficulty. It gradually paralyzes the individual due to the brain no longer being able to communicate with the muscles in the body. Impact and treatment of ALS. ALS reduces one's ability to perform daily activities. Over time, muscles continue to break down. Thus, someone living with ALS will lose the ability to walk, talk, swallow, and eventually breathe. There are no cure for ALS, but treatments exist to aid in controlling the symptoms. Therapies include medication, physical therapy, respiratory therapy, nutritional support, speech therapy, a mental health worker, and a pastoral care provider. ALS care requires a team of doctors, healthcare professionals to work together.
ALS is a relatively rare chronic disease with the incidence rate being 1.5 and 2.5 per 100,000 per year. The average life expectancy with people who have ALS is anywhere between 2 to 5 years, with some people having lived up to 10 years. According to multiple studies, the average age where people are diagnosed with ALS is around 58 to 68 years old. There is nothing that can cause ALS. ALS is formed through the changes in people's genetics, which means around 5 to 10% of cases of ALS are genetically passed down through family. In terms of cognitive changes, 30% to 50% of people will experience cognitive difficulties such as difficulty of speech, verbal communication difficulties, and depressive behavior.
Main characteristics of ALS. ALS is known as Lou Gehrig's disease. There are many characteristics of amyotrophic lateral sclerosis. ALS is a complex chronic disease known as a motor neuron disease. Essentially, it affects the motor neurons and nerve cells that control voluntary movement, such as talking, chewing, and walking. It is also a progressive disease. This means that over time, the chronic disease gradually gets worse. ALS typically occurs in older adults and senior. ALS is caused by death of motor neurons, which eventually stops delivering messages to the muscles. The specific cause of ALS is often unknown but has been related to gene mutation and even chemical imbalance. For example, glutamate, which is a neurotransmitter in the brain, can accumulate because the neurons are not working properly to pass down the action potential down the muscle. There is no treatment or cure for ALS at this time. There are many symptoms of ALS. Some of these symptoms include muscle cramps, fasciculation, which is twitching of muscle, slurred or nasal speech, difficulty chewing or swallowing, difficulty breathing over time, muscle weakness, malnourishment, weight loss, clumsiness, difficulty doing normal daily activities. Also, anxiety and depression can develop over time.
We will now examine one aspect of how ALS can be considered a complex chronic disease. The aspect we will address will be healthcare utilization. As seen in the Kaiser Permanent Chronic Disease Management Pyramid, chronic patients will likely pass through 3 levels in the pyramid, increasing the complexity of their condition and requiring more care and needs that are individualized and provided by healthcare teams. As we know, individuals with ALS have progressive degeneration of muscles and will require more support and care from health professionals and services. This is one of the reasons why ALS is considered such a complex chronic disease. This also places a burden on healthcare resources. Between 2000 and 2001, it is estimated that the total costs related with ALS in Canada was $182.4 million. This cost did not include the costs for medications for patients with ALS. Individuals with ALS will require to seek various healthcare services and access to healthcare providers. Some include primary care and family physicians, a speech-language pathologist to help teach communication techniques, a respiratory therapist to evaluate pulmonary function, and a social worker for emotional support or counseling. These are just some of the many services that can be needed for a patient with ALS.
Physical therapy. This method is used as a way to prevent physical and cardiovascular deconditioning in order to improve independence and quality of life. Since many symptoms involve upper and lower degeneration of the neurons, it might prevent muscle weakness, tight joints, contractures, spasticity, and pain. In addition, moderate exercise was found to preserve the neurons from being completely dysfunctional. Moderate exercise in ALS patients can improve overall symptoms and additionally improve functional scores used when clinical tools are being applied. Some exercises that could be included would be using a cyclometer in combination with active exercises for the upper and lower body opposing the force of gravity for 20 minutes. Similarly, passive range of motion exercises can be used to improve muscle strength. For instance, using stretches in the upper and lower body, which engages 6 muscle groups for approximately 20 minutes, is an effective strategy to improve motor functioning. Furthermore, some aerobic exercises include using a cycle ergometer, a step board, and a treadmill, which can be gradually increased from 15 minutes to 30 minutes over time, combined with 5-minute warm-up and cool-down periods.
Now let's talk about our research based on ALS treatment programs. In 1995, United States approved Riluzole as a treatment for ALS patients because the drug was proven to slow progression of ALS. I'll be discussing a 2002 research conducted by Miller, Mitchell, Lyon, and Moore, who examined two aspects regarding Riluzole in their research. First being the effectiveness of the medicine in increasing the patient's survival rates and health status. Second, the effectiveness in postponing the use of surgical interventions like a trachectomy, which is a surgical procedure of the windpipe so patients can breathe properly, and even other mechanical interventions like respiratory ventilators that can assist in breathing. Now let's look at some of the facts of the study. The research was based on data from randomized controlled trials in which patients were either given a 100 mg of Riluzole pill or a placebo. There were data from 3 trials included in the study, which consisted of 876 patients who were given Riluzole and 406 patients that were treated just with placebo. Now let's look at the result of the study. The first 2 trials showed the effect of Riluzole to be very beneficial. However, the third trial included more older patients with serious symptoms, which led to some evidence of heterogeneity, which relates to validity of the research. With just 100 mg of Riluzole, the control group was seen to have a 9% gain in survival rate probability. Between 6, 9, 12, and 15-month intervals, Riluzole was seen to demonstrate benefits like improved bulbar and limb functions. However, there were no effect on muscle strength. Continuing with the result, patients given Riluzole were noted to enjoy a longer period of stable and modest health status compared to the placebo-treated patients, so they were less likely to need any surgical and mechanical interventions. This particular research states that patients taking Riluzole will live longer, approximately extra 2 months than patients in placebo treatment. The effectiveness of the treatment. ALS has no cure, and patients diagnosed with it will die between 2 to 5 years after the initial diagnosis. In terms of available medicine, Riluzole is the only ALS-specific medicine in the market right now that has an effect on the disease and its symptoms. Doctors often prescribe other medicine alongside Riluzole to control various other symptoms of ALS. It should also be noted that research involving stem cells are being explored as possible future treatment methods. According to the discussed research, this treatment is not highly effective. Only 9% increase in survival rate over a 12-month period and lifespan increase of 2 months. And it is also very expensive. 50 mg of Riluzole is approximately $21 Canadian per tablet. However, if it can improve pain, health status, and the quality of life for dying patients even slightly, Some family members or even government healthcare, like in Canada, might consider Riluzole a treatment option.
Critical analysis of Riluzole. Pedro Scale Criterion 1. To satisfy Pedro Scale Criterion 1, the trials must specify eligibility criteria. In all three trials, the sole determinant of eligibility for inclusion was being diagnosed with ALS. There was no exclusion criteria specified for the three trials. Pedro Scale Criterion 2. In the pooled research experiments, there were a total of 1,282 participants, 876 of whom belonged to the experimental groups that received Riluzole, and 406 of whom belonged to the control groups, which received a placebo. It is written that the groups were randomized, however, the method of randomization was not specified. However, it can be said that the trials met the requirements of Criterion 2 on the Pedro scale. Pedro Scale Criterion 3. It can be said that the trials met Pedro Scale Criterion 3, as it is stated that allocation was concealed in all trials. It did not state the method of allocation, just stated the allocation of participants was considered adequate by a panel of reviewers. Pedro Scale Criterion 4. The trials met the requirements of Pedro Scale Criterion 4, as the groups were all similar at baseline regarding the most important prognostic factors. Although it was stated that some patients from specific regions had a more severe case of ALS, it was also stated that this would not impact the results of the study, as the study was based on the idea of slowing the progression of ALS no matter what the baseline severity. Pedro Scale Criterion 5. It can be said that the trials met Pedro Scale Criterion 5, as it is stated that all trial participants were blind as to which group they were allocated to. It is also stated that all researchers were blind as to which group the participants were allocated to, which confirms that the criterion was met for Pedro Scale Criterion 6. This means that all trials were considered to be double-blind. However, it did not state the effectiveness of the double-blindness as the trial progressed. Thus, it is unknown if the researchers were able to determine which groups each participant belonged to based on the severity of their ALS progression. Pedro Scale Criterion 7. Pedro Scale Criterion 7 was met as all assessors who measured at least one key outcome were considered to be adequately blinded. However, Pedro Scale Criterion 8 was not met, as of the total 1,282 participants enrolled in the trials, 85% were able to give a measurement of at least one key outcome for the first 6 months. After the 6-month point, less than 85% of the total participants remained, but the remainder was still measured for at least one key outcome. The reason that so many participants did not complete the study was due to the high mortality rate of ALS, as 434 patients passed away before finishing the trial. There were also 167 other lost follow-ups, which details were not provided for. Pedro Scale Criterion 9. It cannot be said that Pedro Scale Criterion 9 was met, as for one of the studies it was pointed out that 35 participants were included on the intended to treat analysis. The other two pooled studies showed that all participants with measurable outcomes received the experimental or placebo control as allocated. Pedro Scale Criterion 10. The 10th requirement of the Pedro Scale Criterion is that the results of between-group statistical comparisons are reported for at least one key outcome. After reviewing the statistical comparisons, it can be seen that those who received Riluzole did indeed delay the onset of death. At a p-value of 0.056, the study falls just short of being considered statistically significant. Pedro Scale Criterion 11. Finally, for the 11th and final Pedro Scale Criterion, the study must provide both point measures and measures of variability for at least one key outcome. The combined relative risk of the randomized control trials showed that there was a survival advantage of using Riluzole for 12 months, with a relative risk of 0.78 at a 95% confidence interval from 0.65 to 0.92. Thus, the combined trials met the 11th criterion for the Pedro scale.
ALS is a chronic disease that has no cure. However, we are able to somewhat slow down the progression and aid in relieving some of ALS's symptoms. So, in recent years, the disease has garnered much needed awareness due to social media outlets. However, research is needed in finding more effective and cost-efficient ways to treat such debilitating disease. Thank you for watching.